Hi, welcome to our channel of IGNOU audiobooks, Indira Gandhi National Open University, School of Health Sciences, SOHS, Bachelor's Degree Programs, Post-Basic Bachelor of Science in Nursing B.Sc.N, PB, BNS 107 Pediatric Nursing, Block-1 Trends in Pediatric Nursuing, Newborn and Infant Care, Unit-1 Child Health Care Concepts and Facilities, 1.0 Objectives. After completion of this unit, you should be able to describe the historical background of pediatric nursing, list the factors responsible for the growth of modern pediatrics, define pediatrics and pediatric nursing, list the skills for pediatric nursing, compare the concept of pediatric care from what was and what it is. I. Describe national and international health facilities for children, and explain the functions and sources of vital statistics. 1.1 Introduction. The health of children has historically been of vital importance to all societies because children are the basic resources of the future of humankind. Nursing care of children is concerned with both the health and illness that affect their growth and psychosocial development. The emphasis in contemporary pediatric nursing is upon the child's optimal physical growth and psychosocial development. The holistic health care approach is aided by the nursing process, which is based on the premise that nursing care will be planned and implemented in a systematic, scientific and individualized manner. This unit shall help you to learn about the brief history of pediatrics and pediatric nursing, definitions, the need for certain skills in pediatric nursing and present concepts and trends in childcare. It also describes the various healthcare facilities for childcare in India and focuses on national programs for maternal and child health. Lastly, we have discussed about the vital statistics, its uses and resources, and mortality rates. We shall begin with historical background. 1.2 Historical background of child health. The continuance of any society depends on the succeeding generation. Once upon a time there was no specialty of pediatrics and pediatric 11 nursing as we understand today. Since primitive times, the welfare of the child has been a sensitive index of the general welfare of the people. Whenever general health conditions have been good, the death rate among children has fallen. It rises with deterioration in the health conditions. Children, however, are so helpless that their health depends not only on the general factors influencing all society but also on what adults do for them, feeding, clothing and training them. Thus the history of the pediatric nursing is linked with that of sanitation, hygiene, discoveries in the medical science and general culture of the group. Many specific recommendations for the care of the child are found in the records of ancient civilizations. As early as 225 BC in the Indian Sanhita, there is a description of qualities of breast milk and child hygiene. In ancient Egypt, mothers were advised to dress the infants loosely and feed him at breast. Christian charity greatly influenced pediatric nursing. In the Christian hospitals, at an early date, there was provision for the fondling homes. Pediatrics as a specialty came into being in 1860. Dr. Abraham Jacob established the first children's clinic in New York and gave special lectures on diseases of children. In 1888, the first department of pediatrics was established in Harvard Medical School. It was realized that diseases of children differed somewhat from the diseases of adults. Antenatal health care and pediatrics are essentially developments of the 20th century in so far as the modern system of medicine is concerned. It is difficult to say when pediatric nursing began to be considered a specialty, for it developed gradually as nursing became a profession and as nurses recognized children's needs for nursing care. A century ago, the knowledge of child development was limited. It was not known what is needed for the sound personality development, nor was it known how hospitalization affected the child. The increased knowledge of developmental needs has influenced nursing and made pediatric nursing a specialty. High infant mortality and maternal mortality in India aroused the voluntary women from England to start child welfare schemes in large towns like Bombay and Delhi. Maternity homes were opened and free or subsidized rate milk was distributed to mothers and children. The Lady Chelmsford All India League for Maternity and Child Welfare was established in 1920. Efforts were made to create public awareness about health problems of children by exhibition, publishing a journal, and celebrating baby weeks. The first creche in the country was opened in 1923. Presently, pediatric nursing is being taught in all nursing courses at undergraduate level. Postgraduate education is necessary for those who expect to specialize in the care of the children. With increased knowledge, pediatric nurses' responsibilities has increased. She needs to care for the emotional needs of the hospitalized child, along with the need for physical care. In addition, her responsibility extends to the parents and school teacher in care of children requiring long-term hospitalization. She makes valuable contributions to health promotion of children by participating in child health clinics and preventive health programs. Historical influences have significantly changed the healthcare system as well as the role the nurses play within it. The present concept of health care is on prevention of illness and promotion of health rather than medical care alone. These changes, which are as a result of various factors, are concepts of wellness and illness, changing needs of the society, medical and technological advances in the field of health and medical care, trends within the nursing profession, increased understanding of the psychological aspects of illness and hospitalization, increased consumer demands due to awareness of health needs, stresses imposed upon family life as the society becomes increasingly mobile, movement from agricultural environment to the complexities of urban and suburban living, loss of built-in family support and guidance system, breaking of joint families into nuclear families. The problem of single-parent families, children in daycare centers, lack of adequate space and recreational facilities for children. 1.3 factors responsible for the GRQWTH of modern pediatrics. In the previous section, you saw the changes in child health care through history. Now let us study the factors that were responsible for the growth of modern pediatrics. These are 1. Progress of medical sciences and recent advances in the widespread use of immunization and antibiotics, to development in the field of science in general, physics, chemistry, anatomy and physiology, microbiology and biological science. 3. Interest in public health and public welfare. 4. Improved sewage disposal system. Improved water supply. 6. Compulsory sanitation. 7. Medical examination of food in food establishments. 8. Proper handling of milk and pasteurization of milk. 9. Improved health conditions. Smiley emphasis on diseases prevention and immunization. 11. Improved social laws. 12. Spread of literacy and provision for free compulsory education. 13. Pediatric hospitals, MCH clinics, under 5 clinics, antenatal, postnatal and family welfare clinics and reproductive and child health. 14. Child welfare programs, health promotion and disease prevention programs. 15. The growing realization of special needs of infants and children and the changing attitudes towards the younger members of our society. The essential needs of children during all stages of development are physical, biological, emotional needs including love, emotional security, discipline, independence, and self-esteem. The nurse is involved in every aspect of child's growth and development. 16. Holistic view of health, which is widely accepted today, sees human life as a total system. It implies that all aspects of the total system of an individual are in balance to one another. With this concept, we shall now understand what is pediatrics and pediatric nursing. Before this, revise what has been discussed in previous pages. 1.4 Definitions and concepts. pediatrics is defined as the branch of medical science that deals with the child's development and care and with the diseases of childhood and their treatment. The word is derived from the Greek pais, pedas meaning child, aitria meaning cure. Abraham Jacob, 1830 to 1919, is known as the father of pediatrics because of his many contributions to the field. Pediatrics differs from other specialties because it is not oriented to an organ, system or to a method or system of care. It refers to the comprehensive and continued care of the children. It serves both in wellness and illness states. Today, the trend in the care and nurture of children is based on their developmental needs. Pediatric nursing as a specialty developed with the establishment of departments of pediatrics in various medical colleges, development of separate units for children in general hospitals and in fondling homes, and with establishment of children's hospitals. In the Middle Ages, the concept of child care did not exist. Infancy lasted up to age of 7. Most children did not attend school. Child became a separate entity only when large numbers of people entered the middle class and leisure time increased. Because infants were surviving longer, parents were willing to become more invested in them. Today, we no longer consider the child a miniature adult. Childhood has become a separate phase of life. It is important to see the child as composed of physical, intellectual, emotional, and spiritual natures, and to relate to child as a whole or biopsychosocial spiritual individual. You have seen earlier that a child has been recognized as a person with different needs than those of an adult. Nursing of children, therefore, has been recognized as different from adult nursing. A pediatric nurse must have special skills to look after the special needs of young children as special patients. In this section you will study about the qualities and changing role of a pediatric nurse. These are essentials of a pediatric nurse. I. General behavior. Gentle. She needs to be gentle to touch and in performance as she is working with young and delicate individuals. A child responds best to a quiet, unhurried, confident voice and manner of the care provider, sympathetic and prompt in action. The child, unlike adults, cannot detect and report verbally about his illness state. Nurse must be sensitive to changes in the moods and behavior of children and interpret the crying, refusal to eat, restlessness, and temperamental fluctuations. The changes in children take place very quickly and often without warning. The pediatric nurse must be ever alert and swift in action. She needs not only be alert to symptoms but to be able to anticipate wants and needs of the child of which he himself is hardly aware. She needs to develop skill in identification of physical and emotional distress in children. Honest. The nurse should be honest in dealing with the children and make no promises that are impossible to carry out. To assure that an injection will not hurt is not true. She continues to make efforts in making the painful procedures less traumatic by using diversion techniques. Most of you must be practicing these skills, but this will help you to review and refresh your knowledge in improving these skills. Now we shall turn our attention towards the changing role of a pediatric nurse. 2. Competence. She needs to be skilled in giving physical care to the child. Children need to be told in advance what is going to happen to them. They are afraid of the unknown. Procedures and care. Nurse provides planned care using child-friendly approaches. 3. Communicating skills. She needs to be skilled in communication with the child and the family. It is the most important skill used in the assessment of children and their families. It is the most important feature in developing a trusting relationship with them. Although most of the verbal communication is done with the parent, the child should not be excluded. You can communicate by play. Play is a universal language of children. It is an effective and important technique in communicating with children. When giving directions or seeking cooperation from a child, speak clearly, be specific. Simple language is easily understood. Communicate according to the developmental stage of the child. 4. Providing anticipatory guidance. Nurse should be able to provide guidance in handling a problem in order to prevent complications and teach parents how to provide safe environment for their child. Preventive care is an ongoing part of child care throughout childhood. She should be able to guide the parents in care of the child and how to prevent illness and promote health and prevent injuries by recognizing the need for safety measures and improving environment with the health authorities. Changing role of pediatric nurse. Present concept of pediatric nursing is within the framework of the definition of nursing. Nursing is committed to serving the patient and helping him to meet his health needs. There has been a shift from traditional role to process-oriented role, based on the practice of theoretical foundations and scientific rationale as the basis of care. Look at the screen. The most important emotional need of children is to be loved and to feel secure. The above discussion focuses on that the primary concern of pediatric nurse is welfare of the child and family wherever she practices. She assists the families to promote the highest possible state of health in each child. Increasing attention is being paid to the behavioral and social aspects of child care, especially prevention and management of abuse and neglect of children. Emotional problems and behavioral disorders can be managed in the child guidance centers with the help of child psychiatrists and community health nurses. Many advances have been made in the medical and surgical techniques through the years. Children with defects previously thought to be incompatible with life are taken to special diagnostic and treatment centers for expert attention. The field of perinatal biology has advanced to the forefront of pediatric medicine. Congenital defects can be identified much earlier with the advanced facilities available for diagnostic technology. Chromosomal studies and biochemical screening have made identification and family counseling more significant than ever. 1. 6 health facilities for child health and child welfare. So far you learnt about the concepts and trends in child health. You have also learnt about special skills required of a pediatric nurse. In the following section you would learn about the health facilities and programs for the care of children at national and international levels, welfare of the children in India, and the commitment for the same is enshrined in Articles 24, 39 and 45 of Indian Constitution. The constitutional provisions, child welfare, International Children's Day, rights of the child, legislation in child care and national health policy for children is given in Appendix I, A, B, C, D, E. You are advised to go through these appendices thoroughly. Now we shall focus on few child welfare programs such as Integrated Child Development Program, National Programs for Mother and Child Health and Pulse Polio Program. 1.6.1 Integrated Child Development Scheme, ICDS. Program. The ICDS program aims at an integrated delivery of a package of all basic essential services, with health, nutrition and education to children under 6 years of age, pregnant women and nursing mothers right in their village locality. Objectives of the ICDS scheme are to improve the nutritional and health status of children in the age group of 0 to 6 years, 2. Lay the foundation of psychological, physical and social development of the child, 3. Reduce the incidence of mortality, morbidity, malnutrition and school dropout, 4. Achieve effective coordination of policy and implementation amongst the various departments to promote child development. We enhance the capability of the mother to look after the normal health and nutritional needs of the child through proper nutrition and health education. The following package of services is provided to children and pregnant and nursing mothers in CDS project areas. Supplementary nutrition. 2. Immunization. 3. Health checkup. 4. Nutrition and health education. Referral services. 6. Non-formal education. Efforts are also made for the convergence of related schemes in ICDS project. Areas such as safe drinking water supply scheme, functional literacy for adult, Women, Program of Mobile Health and Extension Units, etc. Supplementary nutrition is given to children below 6 years, pregnant and nursing mothers belonging to low-income families. Children below 6 years age are identified and enlisted for supplementary nutrition on the basis of upper midarm, circumference, and weight related to age and in accordance with guidelines issued from time to time. Supplementary nutrition is given for 300 days in a year. The average cost of food per beneficiary is fixed, which is enhanced from time to time. Therapeutic food is provided to cases of severe malnutrition at higher cost. Nutrition and health education is given to all women in the age group of 15 to 45 years, priority being given to pregnant women and nursing mothers. A special follow-up is also done of mothers whose children suffer from malnutrition or morbidity. The health and nutrition education is imparted through special campaigns, cooking and feeding demonstrations, and home visits by Anganwadi workers. Immunization against diphtheria, tetanus, whooping cough, tuberculosis, and polio is given to all children. Immunization against tetanus is given to all pregnant women. Health checkup services include antenatal care of pregnant women, postnatal care of nursing mothers, and care of children below 6 years of age. Besides immunization against tetanus, pregnant women are given iron and folic acid tablets. High-risk mothers are referred to referral institutions for special care. The health care of preschool children consists of recording of weights of children periodically, immunization, general checkup periodically to detect diseases, and treatment for ailments like diarrhea, dysentery, etc. and deworming against worm infections. Children are also given vitamin A solution twice a year and iron and folic acid, prophylaxis against anemia. Children requiring referral services are provided. Appropriate facilities at the PHCI referral hospitals, district hospital, etc. Children between the age of 3 to 5 years are imparted non-formal preschool education in an Anganwadi in each village ward. The intention is not to impart formal learning but develop in the child desirable attitudes, values and behavior pattern and provide psychological stimulation. Administrative unit for the location of an ICDS project is a community development block in the rural areas, a tribal development block in the tribal areas, and a group of slums in urban areas. In the selection of projects, preference is given to areas inhabited by scheduled castes, scheduled tribes, backward areas, drought-prone areas, nutritionally deficient areas, poorer in development of social services, and Anganwadi is the focal point for delivery of the package of services to children and mothers right in their community in the village or a ward in slum areas. An Anganwadi normal covers population of 1,000 in rural urban areas and 700 in a tribal area. The Anganwadi is run by an Anganwadi worker. The Anganwadi worker, a local woman selected from within the community, is an honorary worker and gets an honorarium. She is responsible for organizing non-formal preschool education in the Anganwadi for children in the age group of 3 to 5 years, 2. Organizing supplementary nutrition feeding for children under 6, pregnant women and nursing mothers, giving health and nutrition education to mothers, 4. Making home visits for education of parents, particularly mothers, eliciting community support and participation in running the program. 6. Assisting the primary health center staff in the implementation of health component of ICDS program with immunization, health checkup, referral, services and health education. 7. Maintaining liaison with other institutions in the village and other village functionaries. 8. Maintaining records relating to delivery of services to children and mothers, etc. 1.6.2 National Programs for Maternal and Child Health. The details of these programs is given in Block 3, Unit 1 of Community Health, Nursing Course, BNS 108. There are various national programs that are carried out as part of MCH program, National Child Survival and Safe Motherhood, CSSM. This program was launched in 1992 by the President of India. It is directed at achieving National Health Policy (NCH) goals, National Diarrhea-1 Diseases Control and ODD Program, prophylaxis against nutritional anemia in mothers and children, prophylaxis against blindness due to vitamin A deficiency among children, control of acute respiratory infections, Universal Immunization Program, UIP. Pulse Program Polio. Package of services under the CSSM program. Look at the service 1.6.3 Pulse Polio Program. Polio virus is highly communicable. An infected person will probably infect all other non-immune persons in a house with poor sanitation. In view of a large number of polio cases being reported from all over the country, Pulse Polio Immunization Program was launched in the year 1995 with the objective of eradicating the dreadful disabling disease from the country. The polio viruses are three related enteroviruses, type 1, 2, and 3, which cause paralysis. Polio drops are administered from November to February, low transmission season, every year on fixed days. In India, the peak transmission is from May to September. There has been a significant decline in the number of cases of poliomyelitis. Pulse Polio Program is reviewed periodically and additional doses are recommended. It is hoped that poliomyelitis would be eradicated by the year 2005 with PPI program, child health care, concepts and facilities. Next likely diseases for elimination are measles and neonatal tetanus. Intensified immunization program is associated with decline in the infant mortality rate in the last decade as compared to earlier years. 1.7 National Agencies for the Welfare of Children. National Agencies for the Welfare of the Children in India are I. Indian Council of Child Welfare, 2. Central Social Welfare Board, 3. Kasturba Gandhi Memorial Trust, 4. The Indian Red Cross Society. These agencies have branches all over the country. They get financial aid from the government to organize child welfare services in the country. The activities of these agencies are 1.8 International agencies. International agencies for child welfare are UNICEF and WHO. We shall briefly discuss about them. 1.8.1 The World Health Organization, WHO, the fast modern transport and the population explosion are bringing the people of the world closer together. The health problems that were confined to a segment of population of a particular geographical area now threaten the whole world. International health agencies i.e. the World Health Organization and the United Nations International Children Emergency Fund, UNICEF, and some other agencies provide assistance to the developing countries to improve their level of child care. World Health Organization was established as a specialized, non-political health agency of the United Nations in 1948. Its headquarters are in Geneva, Switzerland. Daycare services for the children of working mothers, balwadis, nursery schools, and creches are set up to care for the children of working women. Holiday homes are organized for children in the age group of 12 to 16 years. Children can spend their holidays in hill resorts and seaside recreation facilities. These comprise organization of play centers, children libraries, children public parks, Bal Bhavan, children's films, hobby classes, and national museums. Its objective is to assist in the attainment of the highest possible level of health. To do this, it acts as director and coordinator of international health work. It establishes and maintains effective collaboration with the governments and other interested groups, provides health information and technical, educational, and other services to the countries, evaluates countries' health problems where requested to do so, stimulates and advances work to eradicate diseases, prevent injuries, promotion and improvement of nutrition, housing, sanitation, and other aspects of environmental hygiene, promotion of maternal and child health and family welfare. The chief concern of WHO improvement of quality of life of the family as a unit, promotion of mental health, prevention of communicable diseases on an international scale. Almost all the communicable diseases have been at some times the subject and concern of WHO. The global eradication of smallpox is an outstanding example of international health cooperation. Health statistics has been a matter of concern of WHO from its very inception. It has been disseminating a wide variety of morbidity and mortality statistics relating to health problems. WHO publishes International Classification of Diseases which is updated every 10 years. It provides assistance to countries to improve their medical records and in planning and operating national health information systems. WHO stimulates and coordinates research work though it does not itself do research. The activities of WHO are directed towards improvement of human health. In order to meet the special health needs of different areas, WHO has established 6 regional organizations to promote, facilitate, and support national health policy development and development of comprehensive national health programs. WHO has promoted the concept of IMCI, Integrated Management of Childhood Illness, and Government of India has adopted it as IMCI, Integrated Management of Neonatal and Childhood Illness. 1.8.2 United Nations International Children's Emergency Fund, UNICEF, Child Health Care, Concepts and Facilities. United Nations International Children's Emergency Fund believes that future of mankind depends on the well-being of our children. Its slogan is the child of today, for the world of tomorrow. UNICEF is now called as United Nations Children's Fund. It works in close collaboration with WHO and other specialized agencies for the welfare of children and mothers. The present trend is to boost the programs which directly benefit the mothers and children with the concept of care of the whole child, not only of immediate benefit, but also long-term personal development to the development of the countries in which they live. It is interested to meet the needs of the children as an integral part of country's development. UNICEF activities cover programs assisting for child survival, protection and development, interventions like immunization, improved infant feeding practices, child growth, monitoring, home-based diarrhea management, drinking water, education formal and informal. In collaboration with UNESCO, UNICEF is assisting India in improving teaching of science by providing science laboratories, equipment, workshop tools, library books, audiovisual aids. Currently, UNICEF is promoting GoBIF for the welfare of newborn and children. The main areas of focus are G. Growth monitoring, 0. Oral rehydration to treat mild and moderate dehydration, B. Breastfeeding, and I. Immunization against 6 killer diseases e.g. measles, diphtheria, polio, pertussis, tetanus and tuberculosis. F. Family welfare, female child, food and nutrition. Urban Basic Services, UBS. The aim of UBS projects is to upgrade basic services, e.g. health, nutrition, water supply, sanitation, and education, especially for children and women. 1.9 Vital Statistics. Vital statistics may be defined as the facts, systematically collected and compiled in numerical form, related to or derived from the records of vital events. The information on morbidity and mortality and other vital events is important for nurses. The term vital statistics can in its wider sense include information relating to a wide range of human activities, but it is usually applied to a narrower field covering births, deaths, fertility and population statistics. Vital statistics should be 100% complete and 100% accurate and collected at regular intervals. Vital statistics are the basic measurements for assessing the health of the people of a nation. Statistics are most widely used. It is an inseparable part of health sciences. To establish relationship between women literacy and child mortality, we need statistics. If we want to find out the relation of smoking and lung cancer, we depend upon statistics, and if we want to find out the health status of children in the community we need statistics. In health and sickness surveys, health planning, implementation of programs, and evaluation all depend upon statistics. The purpose of learning of statistics is to think quantitatively and to be able to assess probability. Awareness of vital statistics can guide the planning and providing care. Fig. 1.1 A and B. Look at Figure 1.1 A and B on annual population growth rate in the decade of 1991 to 2001 to see the relationship between population growth and Human Development Index. Look at the screen. In 1953, the United Nations approved the principles for a vital statistics system. The system aims to help the member countries to develop a uniform system of registration, interpretation, and comparison of vital events. We shall now discuss about the vital events in following subsection. 1.9.1 Vital events. Vital events discussed in this section relates only to child health. The various vital events have been defined by WHO as follows. Live birth. Live birth is the complete expulsion or extraction from the mother the product of conception, irrespective of the duration of pregnancy, which after such separation, breaths or shows any other evidence of life such as beating of the heart, and pulsation of the umbilical cord and definite movement of voluntary muscles under the Indian Registration of Births and Deaths Act 1969. Birth includes both live birth and stillbirth. Fetal death. Fetal death is prior to the complete expulsion or extraction from its mother of a product of conception irrespective of the duration of pregnancy. Stillbirth. It is the same as late fetal death, i.e. 28 completed weeks of gestation. Infant deaths. Deaths under 1 year of age. Neonatal deaths. Deaths under 28 days of age. Maternal deaths. Deaths associated with complications of pregnancy, childbirth, and the puerperium. Perinatal deaths. Deaths occurring after 28 weeks of fetal FA and within 7 days after birth of the child. Infant and child mortality rates are vital indices of child health status. The growth and development, especially the condition of health of young children, are influenced by socio-economic conditions, cultural and religious beliefs, size of the family and literacy status of the parents, unsatisfactory living conditions, inadequate nutritional facilities, malnutrition, infections, and other health problems are responsible for poor growth and development of infants and child morbidity and mortality. 1.9.2 Uses and resources of vital health statistics. Uses of vital health statistics. To measure the state of health of a community in terms of health problem, their intensity, their distribution among various population groups, for comparison of the health status of one state with the other, from one country with the other, and for comparing the past with the present. For health resource development, for forecasting the health needs of the country, for research, sources of vital health statistics, the census, registration of vital events such as births, deaths and marriages, notification of communicable diseases, records from hospitals and health centers, health and morbidity surveys, surveys on particular diseases, national sample surveys, NSS, the annual demographic yearbook of the United Nations, the epidemiological and health statistics reports of WHO. 1.9.3 Mortality rates. Before discussing mortality rate, let us define crude birth rate. The crude birth rate, CBR. The crude birth rate is defined as the number of live births during a year per thousand estimated mid-year population. Birth rate is equal to no of live births during the year divided by estimated mid-year population multiply 1000. Infant mortality rate, IMR. Infant mortality rate is defined as ratio of infant deaths registered in a given year to the total number of live births registered in the same year, usually expressed as a rate per 1000 live births. It is a reliable indicator of health status and well-being of children. IMR is equal to number of deaths in a year of children less than 1 year of age divided by number of live births in the same year. Multiply 1000. It is described as one of the sensitive index of health status of the population group. There has been seen a steady decline in the infant mortality rate all over the world and, more significant, in the developed world. This decline is attributed to the socio-economic developments in the region, better control of communicable diseases, advances in chemotherapy, antibiotics, and insecticides, healthy nutrition, and better obstetric and other health services. The infant mortality ranges from 70 to over 200 per thousand in the developing countries compared to 7 to 10 in the developed nations. IMR in India has declined from 96 during 1986 to 72 in 1998, a decline of 25%. Perinatal mortality rate, PMR. The perinatal mortality includes late fetal deaths and early neonatal deaths. The perinatal period is the period from 28th week of gestation to the 7th day after birth. PMR is equal to later fetal deaths, stillbirth death under 1 week, divided by live births in a year multiply 1000. Neonatal mortality rate, NMR, deaths occurring in the first 28 days of life are called neonatal deaths. The neonatal mortality rate is defined as the ratio of neonatal deaths in a given year to the total number of live births in the same year, usually expressed as rate per 1000. NMR is equal to number of deaths in a year of children under 28 days of age divided by total number of live births in the same year into 1000. Neonatal mortality is responsible for more than 60% of the infant deaths. There are vast urban-rural differences. Deaths in the first months are caused by maternal and delivery-related factors. Neonatal mortality is greater in boys throughout the world because newborn boys are biologically weaker than girls. Under 5 mortality, probability of dying between birth and 5 years of age. Expressed per 1005 births, age-specific mortality rate, ASMR, age is equal to number of deaths in a specified age divided by total no of children in that age into 1000. 1.10 Summary. In this unit on child care concepts, facilities, and vital statistics, we have discussed about the historical background of child health. It is only in 1860 that pediatrics has emerged as a separate specialty, and in 1986 the first department of pediatrics was established in Harvard Medical School. We have also discussed about the factors which are responsible for the growth of modern pediatrics, such as progress of medical sciences, advances in immunization and disease prevention, focus on MCH care and child welfare, etc. Skills of a pediatric nurse such as gentleness, skillfulness, promptness, etc., and changing role of a pediatric nurse which focuses on shift from disease-centered care to child-centered care are also discussed in detail. A detailed account of child health care agencies, national and international, is also dealt in this unit. Finally, we have discussed about the vital statistics, vital events, and mortality rates in children. Thank you. Subscribe to our channel for more updates, and we will see you with the next chapter.